What if I told you that a condition that starts quietly, sometimes with no pain at all, can suddenly become life-threatening for both mother and baby? No fever, no obvious infection, just high blood pressure and hidden danger. Today, we are talking about preeclampsia, one of the most serious complications of pregnancy and a major cause of maternal and fetal complications worldwide. What is preeclampsia? Preeclampsia is a pregnancy-related disorder characterized by high blood pressure and damage to organs, most commonly the kidneys, liver, brain, and placenta. It usually develops after 20 weeks of pregnancy, and it can also occur during labor or even after delivery, called postpartum preeclampsia. One key thing to remember: preeclampsia is not just high blood pressure. It is a systemic condition that affects multiple organs. Clinically, preeclampsia is suspected when a pregnant woman has blood pressure greater than or equal to 140 over 90 millimeters of mercury, plus protein in the urine or signs of organ damage. Why does preeclampsia happen? The exact cause of preeclampsia is not fully known, but it starts in the placenta. Normally, blood vessels in the placenta develop smoothly to supply enough blood to the baby. In preeclampsia, these blood vessels develop abnormally. They are narrow and stiff. This leads to poor blood flow to the placenta, reduced oxygen and nutrients to the baby, release of substances that cause widespread blood vessel constriction. As a result, the mother's blood pressure rises and organs begin to suffer damage. Think of it like faulty plumbing. Pressure builds up, and the entire system starts to malfunction. Risk factors. Preeclampsia can happen to any pregnant woman, but the risk is higher if it's a first pregnancy. There's a history of preeclampsia. The woman has chronic hypertension. She has diabetes, kidney disease, or obesity. She's carrying twins or multiple babies. Pregnancy occurs at extremes of age, teenage or over 35. But remember, absence of risk factors does not rule it out. Signs and symptoms. This is where preeclampsia becomes dangerous. It can be silent. Some women feel perfectly fine. When symptoms appear, they may include persistent headache, blurred vision, flashing lights, or visual disturbances, swelling of face and hands, sudden or severe, upper abdominal pain, especially on the right side, nausea and vomiting, reduced urine output, sudden weight gain. These symptoms should never be ignored during pregnancy. Effects on the mother. If not managed properly, preeclampsia can progress to serious complications such as eclampsia, seizures, stroke, HELLP syndrome, hemolysis, elevated liver enzymes, low platelets, kidney failure, placental abruption. This is why early detection is critical. Effects on the baby. Because blood flow to the placenta is reduced, the baby may experience intrauterine growth restriction, low birth weight, premature birth, stillbirth in severe cases. The baby's survival often depends on how early the condition is detected and managed. Management and prevention. The only definitive cure for preeclampsia is delivery of the baby and placenta. However, management depends on severity of the condition. Gestational age. Management may include regular blood pressure monitoring, urine and blood tests, antihypertensive medications, magnesium sulfate to prevent seizures, early delivery if the condition becomes severe. Prevention strategies include early antenatal looking, regular antenatal visits, blood pressure checks. Preeclampsia is serious, but with awareness, early detection, and proper care, lives can be saved. If you are pregnant or caring for pregnant women, remember this: routine antenatal care is not optional. It is life-saving. If this explanation helped you understand preeclampsia better, like this video, share it with someone who needs it, and follow for more clear nursing and health explanations. This is Nursing Clarity, where complex concepts finally make sense. Bye for now and stay healthy. I will see you in next video.